Hello, I'm NadiaAl-Samarrie. Thank you for joining me. Today, I want to talk about why people with diabetes are not seeing their healthcare professionals during the pandemic. The CDC reports that delayed or avoided medical care might increase morbidity and mortality associated with both chronic and acute health conditions. By avoiding routine medical appointments because we fear getting COVID in a clinic or a hospital, in fact, may create a bigger problem for us. Today, we're going to speak to two people who will weigh in on this topic, how it's affecting us, and how we can gain confidence and comfort in seeing our healthcare professionals during a pandemic. Thank you for joining me today. Can you briefly introduce yourselves to our audience?
Yes, hi, I'm Dr. Leonard Glass. I'm Vice President of Lilly Diabetes Global Medical Affairs. I'm an endocrinologist, and my specialty is type 2 diabetes and insulin resistance, although I've treated patients with all kinds of diabetes.
Hi, I'm Karen. I've lived with type 1 diabetes since 1979. I currently work at Diabetes Sisters. I'm the content manager there, where a big part of my job includes overseeing our social media engagement on Twitter, Facebook, and Instagram. I'm really happy to be here to discuss why it's so important for us to get back to the doctor for input on managing diabetes.
Dr. Glass, why is it important for people to safely return to care, specifically for people with diabetes? What are some of the consequences people with diabetes face when they stop going to the doctor?
No, thanks for the question. Patients with diabetes really need to follow up with their primary healthcare team because they need to check lab values, like, for example, the hemoglobin A1C, and they have to have frequent physical exams as well to make sure that they're not having any progression of the complications of diabetes or any new complications from diabetes. This can only happen if you're following up with your healthcare team. So doing this frequently allows for the team to realize if there needs to be any changes to their medications or to their care. And if you're not going and having this test done or physical exams done, then they can't really make any adjustments to your treatment.
So at the very least, they have to go in every 3 months.
Well, going in necessarily, not particularly. They could be exchanging virtual visits between live visits. That can also happen, but they at least need to be followed up every 3 months. And the lab work, including the hemoglobin A1C, needs to be done.
Karen, did you stop going to the doctor when the pandemic first started? And if so, what inspired you to go back to the doctor?
Yes, I did stop going to the doctor. I really stopped going anywhere because I was so afraid of becoming critically ill as someone living with diabetes. But I did realize the importance of seeking necessary care. I was lucky that my healthcare team was very understanding and they allowed me to schedule some telehealth appointments during the pandemic. Now that I'm fully vaccinated, I'm more comfortable going back to my doctor's office to receive the in-person care that's so important to get. I also heard from other people living with diabetes that the doctor's office felt very safe when they returned. And when I did go back, I was happy to see that although the COVID numbers in Connecticut, where I live, continued to decline, my doctor's office has still kept safety precautions in place.
So Karen, did that influence you that you knew other people that went to the doctors and they said, it's really a lot safer than you think? Don't worry. I know I had those same fears.
Yes, the power of Me Too is always very helpful when you see that someone else had the same fears you had, and then hear that they tried going back for an appointment anyway and felt good about it. It gives us a lot more confidence.
Dr. Glass, what are other options that are currently available for people with diabetes who want to go back to care but are still timid about it?
Well, I hinted about that a little bit in the prior question. The patients now have a few options. A lot of physicians and practices are having telehealth visits. Part of that visit does require, though, like I said before, the hemoglobin A1C test, which is extremely, extremely important to follow up and find out how your therapy is doing. So you could have a telehealth visit, for example, but you could schedule ahead of time with the team to go and get your lab work done at another place. There's also the availability of a hemoglobin A1C test that can be done at home. So if you arrange for that, you can get the test done at home and then give the result to your healthcare team.
And for people that have the BGM with connectivity and a CGM, I would imagine that's even better when you're doing a telehealth appointment, because the healthcare professional, if you give them permission to have access to it, then it really is, then they have the data that they need to help you.
For those patients that have that, that's a really good option as well. You arrange ahead of time with the team and you can send your results. Right now, you can send them through the cloud. You can send them in many different ways. A lot of clinics have links where you link your data directly to the clinic, and they can also monitor your blood glucose from there, either from your BGM or from a CGM as well.
And have we seen more people, has there been an uptick in telehealth? I know for me, I never did a telehealth appointment except for the pandemic, because I still didn't want to go in, and it was a nice option.
Well, there has been an uptake. Definitely, it's been a little bit of a forced uptake. The circumstances forced us to really adopt it. But there's been some learnings with it. And part of the telehealth visits at the beginning, for sure, did not have the lab work, for example, that the physicians needed to follow their patients. So there's been learnings along the way. And now I think we've learned a little bit more what we need to do and how we should schedule those visits and what's the information that we need before the visits.
I think that's true. Like anything that's new, we learn what was missing, afterwards. It's not usually during, because it's new. You're trying to understand the patient, get the information, and then once the appointment it's done, then you can think of, well, I could have had the CGM, BGM numbers before. So I can see how that would evolve like anything.
Yes, I think it's important from a patient's perspective also. Patients need to be very involved in their care. So their patients themselves have to actually think about this as well, not just expect always the healthcare team to ask for those numbers, that you have to go and say, hey, I'd like to share these numbers with you, or is there a way for me to share these numbers so that you can actually help me treat myself? And
I think that's really important. I have family members that when they were diagnosed with type 2 diabetes, I've never heard from them so much. They literally called me or text me every day. And the things that they tell me, I was like, oh, okay, well, those numbers means you need to call your doctor and ask them these questions, and then if their medication, it was, either they were getting a low blood sugar for type 2 at night, or, a high blood sugar. So then I would say, well, these are the questions you need to ask your doctor. And they did do that. And they did call their doctor and they did have those discussions. And it was really impactful. Not, you always think that you have to see the doctor to get that kind of result. But as we're changing, and the way we process information in healthcare professionals is also changing.
Yes.
Karen, how has telehealth impacted your care?
Well, during the pandemic, I worked with my doctor to figure out how telehealth could help continue my care. Early on, I was told that my doctor was not accepting telehealth appointments. He would only do in person. And because I wasn't comfortable, I rescheduled my appointment. When it rolled around again for the one I rescheduled, then they were agreeable and doing telehealth. And that made me feel really good. And before that telehealth appointment, as Dr. Glass said, I did go to the lab and have blood work drawn. So my doctor had my A1C and my other tests. And I also looked online. There were a lot of resources with tips for how to prepare for a telehealth appointment as opposed to an in-person appointment. So I myself felt prepared.
Oh, that's interesting. Could you share some of that? Like, how would you have to be more prepared with a telehealth?
When I go into the office, my doctor can download my pump, download my CGM, look at all of the information that's on there. So before telehealth, I had to think about other ways where I can get my data to my doctor so he could take a look at that. As I said, he already had my lab results, but it's always more helpful if he can also see what's going on with my pump and my continuous glucose monitor.
Right. And probably when you're getting ready for a telehealth appointment, you probably are looking at your numbers and patterns before you're speaking to the healthcare professional, I'd imagine, where when we're in an office setting, we're more reactive to the questions that they're asking us.
Right. Yes, I agree.
Dr. Glass, so what would you recommend? Do you think you should, once the pandemic's over, is it you should go to the appointments, you should do telehealth, you should do a hybrid of both? What are the recommendations now that we've had the experience of all of these different ways of visiting our healthcare professionals?
I think each patient has to find what's best for themselves and their physician and healthcare team. But at the same time, there's some things that you need to keep in mind. I realize, like Karen said, and a lot of people across the country and the world have been afraid to go visit their physicians and clinics during this pandemic. I think we have learned from it, and we have things in place right now, preventive measures. People are getting more vaccinated, so vaccination has helped to ease up some of the restrictions. And so people are feeling more comfortable now going to see in person their healthcare team. But at the same time, some folks may feel more comfortable still having some telehealth visits. So in order to do this the best way, I think you have to definitely be comfortable, because if you're not comfortable, it's not going to be worth your while, or the team's a while either, or you're not going to go at all. But you definitely need to have at least a telehealth visits where you can have your lab work. But it's not all about lab. That's also very important, because there's some things that have to happen during the exam that can only be done in person. And we have to check your blood pressure. We have to check for signs of neuropathy. So having those tests done, we have to make sure that there's no breaks in the skin, or that there are no other problems going on. So it's still very important to have those live visits. I think it's worth a discussion, and discuss what your concerns are with your team, and then make a decision that's good for you.
I think it's also good, like myself, I was really forced into it. I really like seeing my doctor personally, and I was really forced to do a telehealth appointment. But then I realized, gosh, this is so much easier. I don't have to get dressed, get in my car, drive somewhere, park, go check in. I mean, it was so much easier. I was really surprised. And now, just because I've done it once, I'm open to it in a way that I wasn't open to it before. So I think you're right. I think part of it is, whatever is comfortable for you. But sometimes I think we have to push ourselves to try things that we haven't tried, because we can't. How can you judge something that you haven't even tried?
Yes, no, I think you have to definitely try it, and it's worth it. You don't always need to do the same things when you go visit the physician. Sometimes they'll just need to check your labs, and just to check your labs, you don't necessarily, now we've learned, you don't have to go in person. You can do that through telehealth. And then get your results. And actually, you get them now on video conference as well, which is great. You can see the person face to face. Still, I want to stress that there are some things that right now you can only do in the office, and there's still sometimes that you do need to go to the office, but it shouldn't be all the time.
Karen, as a person living with diabetes, what advice do you have for the diabetes community in terms of the telecare versus going into the clinic to visit your healthcare professional?
I think the most important thing, as with most things with diabetes, is to talk to your doctor and figure out what's right for you, because we're all very different. I know for me, telehealth was a great option, especially since I was able to upload my data and get my blood work done. But on the other hand, once I did go back, I felt a lot of relief knowing that I was able to sit down with him in person. He checked my feet, he did my weight, he checked my blood pressure, listened to my heart. It was good to know that all those things had been looked at.
Right. And I'd imagine it's always nice to see people in person when you're communicating with them, because we all need that connection with our healthcare professionals, with our support team. You're with Diabetes Sisters, you know that better than a lot of people, that it's really important to have a team that you can trust, that you know doesn't judge you, that you can communicate with.
Exactly, yes.
Dr. Glass, any additional comments or thoughts you'd like to leave with us today?
Thanks, Nadia. I think the most important thing is for patients to realize that for those of you who have delayed care because of the pandemic, it's important to come back and see your healthcare team. So that is the most important thing that you need to do, because diabetes is a progressive disease. There needs to be adjustments to your medication, and having that connection with your healthcare team is extremely important, and that follow-up is very important. So what you need to do is connect back and then check what is the best option for you, whether you need to go to telehealth, whether you want to go back to the office, or whether you want to have a mix of that. But that always needs to be a conversation with your healthcare team.
That makes a lot of sense, that you can actually do both, because some don't require you to be in there.
Right. I think that some, like we mentioned before, there's some things that you don't always need to go in person, and that way you can minimize the risk if you still feel that you are at risk. Definitely people with diabetes are at risk, but if you really don't want to go back yet, or you don't feel as comfortable, you can say, okay, there's some visits that I don't feel as comfortable going in person. Maybe I can decrease the number of times I have to go to the office. And that's a possibility as well. But there are some things that require you to go back so that they can do the proper follow-up at times.
And I think those were good things that you both said, which is your blood pressure, checking for neuropathy, checking your heart rate, certain things that you're right, you can't really see that, and it's not something that you could do at home. But as Karen mentioned, if you're doing the blood work before, then that's something it is conducive to a telehealth appointment if you had concerns in terms of going in and seeing the doctor.
Right.
Karen, any additional comments and thoughts you would like to leave us with?
Yes, I think it's normal to be nervous to go back to in person with this pandemic. But in this case, as with any case with diabetes, open communication with your provider is really the best. Sometimes as a patient, I know I'm embarrassed to talk about my concerns, or I'm nervous to ask a stupid question, and that's not going to get you anywhere. So if I'm honest with my provider and talk about my feelings, then he can address them, and together we can work on. So I found it's always best just to be honest with my provider about my concerns, and we can work together to find solutions that work for both of us.
Question, when you go in to see your healthcare professionals, so do you have a list of questions? Do you prepare before you go in, even if you think they're silly? And then when you're going through your list, do you sometimes skip some of the things that you think that are silly, or would you just go ahead and ask those questions?
I always do go in with a list of questions. I start working on it at least the week before, but sometimes even in the upcoming months, as I think of things, I jot them down on a little note in my phone. I always ask them all.
Well, thank you both for joining me today. That was very illuminating, and I think it'll be very helpful for people that have been concerned about going back and seeing a healthcare professional.
Thank you, Nadia, and thanks for all the sharing of information, Karen, as well, from your personal stories. It's very helpful.
Thank you. It was a pleasure to be here.
And to my diabetes health community, thank you for listening. I love knowing that you're here. From Diabetes Health, I'm NadiaAl-Samarrie.